Hey, it's Greg Downing here with Texas Medicare and Health Insurance Advisors outside of beautiful Austin, Texas. And today I'm going to share with you that unfortunately costs are going to be going up next year with the Affordable Care Act, Obamacare, whatever you want to call it. And the main reason why is the enhanced tax credits are expiring at the end of this year. Now, what are the tax credits? Well, that is where the government, during COVID and the American Rescue Plan and the uh, inflation reduction, all that, they decided that they're going to help out people and give them more tax credits to buy a health plan. And that was great, but those are all set to expire at the end of this year, and I am 99% sure they're not going to be extended. So that means you're going to be paying more for your health insurance, myself included, and I am so excited. So here's what that actually means to people. We're just going back to the way Obamacare was designed in the first place, and that is that based upon household income determines the tax credit you get to buy a health plan. And again, the tax credit is just an amount of money based upon your income that the government will send to your insurance company that you select. So people that make over 400% of the poverty level this next year aren't going to get squat nothing for a tax credit. So what that means is if you make over 61,000, these are going to go up a little bit. You're probably getting a tax credit now, but you're not going to get one next year. And you can see these, you're figure all that out, and the chart will be there. But let me give you an example of what that means for some people. Okay, let's get right over here. All right, so it's just on healthcare.gov, and I put in my information, and then on my household income, just for an example, I put 70,000. Okay, so $70,000 is my income. I'm a single person in this situation. Hit continue. Guess what? Currently, today, I would get $656 per month to buy a health plan. Well, next year, I would get nothing, okay, because that's over the 400% of the poverty level. So these are just things I'm letting you know to be prepared. So it's very important that we get your information updated and get you what you need. Let's get back over here. Let's go to where we need to go. Okay, now, so that's one thing. There's also more changes that are happening to keep us all on our toes, and that is much more compliance and verification. That's one of the reasons I got to get you fill out that form is I have to actually get your permission to help you get a health plan, okay? And so verification, if you just make up a number of income, you're going to have to prove those things. They're just really tightening down on people that are getting money. Also, if you're one of those rare individuals that are paying nothing for your health insurance, when that renews, if you don't update your application, you're going to automatically have to pay at least $5 for your plan. And the reason they're doing that, believe it or not, there are people that will actually sign people up without their knowledge to get a commission on a health insurance plan, and they set them up where there's no premium, so that person doesn't even know they have a health plan, and I've ran into that twice this year. So it's crazy. So we're going to have things like that, paying attention. Aetna's leaving the healthcare marketplace. They're gone. So if you're on them, we're going to have to get a new plan. And next year, the maximum out of pocket is going to be $10,600. Just crazy. So it's going from $92 this year to $10,600. All right. Some good news is short-term plans are coming back. They're not going to enforce the Biden regulations, which they should have never done that in the first place. But there are going to be, if you are healthy and you don't have any pre-existing conditions, we will have other alternatives for you that will be less expensive, and actually even some PPO plans through associations, different ways that we can help you get that. But these are only for people. I can't get them, unfortunately, because I have a pre-existing condition. I've had a heart attack, and none of these plans are going to take me. But That's just something we'll talk about later. More details when we have actual costs coming up. So remember, the annual enrollment period starts November 1st, okay, and goes through December 15th. So as you can imagine, this is a very trying time for us to try to help all people in 45 whopping days. So what I'm asking that you do, please help me complete that compliance form and give us any updates as soon as you can. And so main thing we're looking for, if you're getting a tax credit now, we need to know what your projected income is going to be for 2026. Because if you make up something and you have to give all that money back, you're not going to be happy. All right, if you've got any changes to your household, if you've added, you've had some babies, if you've moved, we need that information. If you got a kid that's going to college, probably one of those bright ones there in the corner, and they're going to be off the policy, let us know that. If you've got new doctors or new hospitals or new conditions, something's going on, let us know about that. And then what we're going to do, let me go back here, is get that. So I'm going to show you what that form looks like and help you walk through it. I don't want you to be stressing out about stuff. Where's that? There it is. Okay, sorry about that. I'm a genius at all that. So when you click on that form to fill it out, you're going to have my pretty ugly mug there. John Gregory Downing. Yes, I am John Gregory Downing. Got to use my official name for insurance. Hit this button. Let's go. All you got to do is type in your name, old John Doe. Hit the button that says OK. Let's get started. OK. Put your email address in there and then hit OK. And then if you have not moved and you have the same address, nothing changed, you don't have to fill this out. That's okay. But if you do, definitely do that. You can hit OK. I don't want you to work more than you have to. And just go ahead and hit continue. How many people are in the household? If you and your wife, this situation here, we got 2 people, Mr. and Mrs. John Doe. And so just, again, your name will pop up. You're going to need to put your date of birth in there. Very important, your annual projected income. That is your adjusted, modified, gross, anything you pay tax on. That's what we're looking at. And if you use tobacco, and then I am that person. Now, and then enter in the next person, that's your spouse, their date of birth, tobacco use. And if they don't have any income, sometimes you need to put a 0 in there so to let you continue. And then just relationship, spouse, kid, whatever it may be, hit that OK button. All right. Does this member require coverage? Yes. All right. Now, I'm not really dead set on, I got to have your prescriptions. Really, I don't really care that much unless you're taking something real expensive. But, this will actually do the sort for you. Right there, Crestor, add that. And then I take the generic, but I can't ever remember the name of it. So, yeah, I'll take that. And then you can add your, if you want to, but, I'm just concerned about if somebody's taking something real expensive. And then you can add your pharmacy that you want to use if you want to. Mainly, I need to get this right here. What hospital you want to use, because all these things are so network driven, it's critical. Or if you're using a new doctor, St. David's, so that hospital's in there. And then add your, your doctor in here, Dr. Loser. And then, whatever the name of their practice is, bad office. Okay. And you add a specialist, any of those things, because we got to make sure they're in network. All right. So this takes a little bit of time, but don't get too worried about. And then, just to keep this simple, I'm going to say that she doesn't need any insurance, but if you do, you'd fill out all that same stuff. And we hit OK. You're almost done. OK. And then I got to put the phone number in there. Hey. And then if you want to type anything in there, how the kids, that's okay. But if you do have something in there, it's always helpful to get more information, or, if you got a procedure or something coming up, let us know that. The more we know, the better we can help you. All right, so you put that in there. wrap it up. And CMS, this is another compliance. They require your consent before we can provide plan recommendations. So you put okay, and then again type in, John Doe, give my permission to John Gregory Downing to serve as my health, blah, blah, blah. I gotta do that again. Different person this time. I don't know why. I'm just trying to get through this. All right, and then sign and complete. Another government compliance form. And the reason we're doing this, remember I told you about those people get signed up, they didn't even know it? That's what happened. So they're making us do all these forms. So when that's done, I get a text that you've sent that to me, and I can add that to your contact information. So that way I got everything ready. So come November 1st, when the race is on, we can start looking for a plan for you. And remember, I'm compensated by the insurance companies to, help you find these plans. So I know it's busy. Work with us, because I don't want to lose you as a client. Because if you get it all done yourself, guess what? I lose all my commission and it's out the door. So you're not bothering me. We're just trying to get this done, and we really appreciate the fact that you are our clients, and we want to keep you that way. So if you have any questions, give me a call. But that's it for now. Just make sure and complete that form, and I'm going to be giving you more information the more we know it, but this is what we know right now. So with that, you have a fantastic day.